Balasubramanian, and from representing the BRLMs, we have Mr. Gaurav Singhvi, Co-Head Institutional Syndication, ICS Securities Limited, Suhani Bareja, Equity Capital Markets, Jefferies India Private Limited, Mohit Bajpai, Executive Director, JM Financial Limited, Varun Behel, Executive Director, JP Morgan India Private Limited, and Mr. Mahesh Natarajan, Executive Director and Head ECM India, Nomura Financial Advisory and Securities India Private Limited. Without much, we co-head Institutional Syndication ICSI Securities Limited to make the opening remarks.
It's my pleasure to be here, and on behalf of Inventurous Knowledge Solutions and the book running lead managers to the issue, I would like to extend a warm welcome to everyone present here. A technology-enabled healthcare solution provider mainly focused on the US markets. We at IKS Securities had the privilege of partnering with IKS Health for over 3 years now. We have witnessed the company reach this important milestone of an IPO has been truly gratifying for all of us involved in this IPO. IKS Health, by taking over the operational and administrative burdens, they enable their clients focus on their core mission of delivering patient care. By combining advanced technology, human capital, and clinical expertise, IKS can unify diverse healthcare processes into a comprehensive platform that serves as a one-stop solution for healthcare delivery. Today, I am pleased to have Mr. Sachin Gupta, Founder, Director, and Chief Executive Officer of IKS here with us. Issue of 18.8 million equity shares. The price band of the issue is from 1265 to 1329 per equity share. Some of the key dates: the IPO will be open from subscription on Thursday, 12th of December and will close on Monday, 16th December. The anchor of the issue is on December 11th. In the end, we believe that investors will be essentially backing a charismatic and driven founder who is leading a company with a unique business proposition in an industry on the cusp of even greater growth.
Large opportunity and inefficiency in US healthcare. I don't know how many of you realize, but the US healthcare industry is a $4.8 trillion industry. And we talk about India's GDP being $3.5 trillion, growing at 6.5–7%, and what a great opportunity it presents. I totally agree, being an Indian. But think about US healthcare, $4.8 trillion, growing at 7–8% with absolutely no cyclicality. Why no cyclicality? Because more and more people in the US need healthcare. Population is aging, lifestyles are getting sedentary, chronic lifestyle disease, diabetes, COPD, congestive heart failure is on the rise. That means more and more people need care. As more and more people need care, healthcare will keep growing with absolute secular structural manner. So that's the type of opportunity set that US healthcare presents. And when we were starting this business back in 2006, the US healthcare ecosystem was going through what I call the perfect storm of cost-quality access. What do I mean by that perfect storm of cost-quality access? At 20% of GDP, US spends more as a percentage of their GDP on healthcare than any other advanced economy in the world. Their GDP is growing at an average of 2–3%, barring these COVID years, and yet healthcare is growing at 7–8%. So they're spending more than any other advanced economy. They're on a huge budget deficit, and their growth of healthcare is 7–8%. That means you have a fundamental cost problem. Second, you have an access to care problem because the number of patients that need care is growing much faster than the number of doctors, nurses, caregivers to provide the care. Why is that happening? Because chronic lifestyle, and that creates the need for more and more care. So today patient access is a big problem. What do I mean by patient access? New patient wait times for primary care doctors, for example, are 45 to 60 days. For specialists, that number goes to 6 to 9 months. So you have a cost of care problem, you have an access to care problem, and then you are starting to create a quality of care problem. Why? Because US healthcare is highly regulated. And the regulators, in order to bend the cost curve and improve quality of care, keep introducing newer and newer regulation. And the unintended outcomes of that regulation is what I call a whole bunch of administrative tasks that get created, that these doctors and nurses get further saddled by. So in a world where doctors and nurses need to see more and more patients to improve access to care, today they are spending more than 50% of their time on non-patient care, non-discretionary tasks. That is creating this whole phenomenon called administrative burnout, and that administrative burnout is leading to quality errors. And Johns Hopkins University in the US publishes an annual statistic of number of deaths due to medical errors. That number is north of 150,000 today. So that's why I call it the perfect storm of cost, access, quality. And when such perfect storms are brewing in such a large industry, there are some fundamental transformations that happen. One such transformation that we saw coming is what I call the transformation from reactive, hospital-centric care delivery to proactive, physician-led and patient-centric care delivery. What do I mean by that? So think about it. If your predominant cost of care is driven by chronic lifestyle diseases like diabetes, like congestive heart failure, if you try to manage that